I'm Dean.
Dean definitely experiences procedural anxiety when we have to do certain things with his CF care. We first found that when he had his first inpatient stay when he was about 4 and had to receive a PICC line. That was very upsetting for him. Became very stressed out about it, and that has kind of fallen over into procedures as we move on now.
Procedural anxiety manifests itself very differently. I've seen anything from a child telling me, I'm afraid about what's gonna happen, to being tearful, crying, kicking, screaming. In the most extreme cases, we'll cancel the procedure because we know that it's not gonna be safe.
My name is Monique. I'm 23 years old and I live in Salem, Massachusetts. The procedures that make me most anxious, first of all, is getting a PICC line. A PICC line is not a super invasive thing, but my brain tells me anyway that it's scary and it's horrible and that I need to be afraid of it. Another procedure that makes me anxious is doing a PFT test. I'm almost afraid of the results. I'm afraid of disappointing myself and disappointing my care team.
Monique's procedural anxiety is fairly common. Knowing what a patient is going to need to get them through the procedure is most important to minimize that anxiety.
When Dean gets nervous and upset or anxious about anything that's going on with clinic, he kind of shuts down. He'll sometimes will sit on the floor and kind of turn into a little bit of a ball, cry, go away from wherever we are, and try to just kind of not have that happening.
When I have procedural anxiety, I often get really restless. I'll be unable to stay still for very long. I'll be messing with my hands, messing with my hair. I'll be unable to relax or sleep, and I just fall into a cycle of just thinking, and I'm unable to do much of anything else.
The reality is, there are lots of things that can build into that cascade of that anxiety kicking in. So, for example, things like a really rotten night's sleep, the stress of driving in the car on the way to the clinic appointment, getting to the parking garage, not being able to find a spot. There are so many things that contribute to that buildup. It's like the ball starts rolling down the hill and it starts collecting a lot of things. And by the time you get to the procedure, your body is having a big reaction.
Everyone who's had a PICC line knows that dressing changes suck and they're just the absolute worst. And I had a nurse one time who I was wincing through it because, they're ripping tape off your skin. And she said, "Oh, it doesn't hurt that bad, come on." And immediately, I felt like I could not talk to this nurse at all when someone who you're supposed to trust with something as important as your medical care, when they say an offhanded comment that's callous, it feels so invalidating and just like, it's so hard to be open and to have a conversation with someone who says things like that because you automatically feel they're gonna invalidate me, they're not gonna listen to what I say, and anything I say is going to be basically no. So what's the point in even trying?
Validation really just means appreciating that someone had an experience, and I don't need to put that in a category of right, wrong, valid, or invalid. It just is true from their perspective. Let's figure out what we can do together to help you move forward.
I use my developmental knowledge as a child life specialist to anticipate what certain stressors might be. When I know, I can work with the parents and the care team to create a plan that's really personalized to each patient and really work to figure out what the unique stressors will be for this patient and then what I can do to mitigate that stress and trauma associated with it. There are a couple key techniques that I think are really helpful when addressing anxiety in the moment of the procedure. The first is a comfort position. So this allows the parent or their trusted adult to facilitate a hold that's not only keeping them safe during their medical procedure, but is there to provide that tangible, positive touch and that comfort and support. The next thing that I like to utilize is alternative focus or distraction. And that is offering the child the ability to take their mind to a new place, to focus on something else besides the procedure at hand. For other kids who do better and feel more in control when they know what's happening, we let them watch so that they feel confident that they know what's happening to their body and it gives them that sense of control.
Something that's helped me in ways that I never even imagined has been seeing a therapist and talking with someone who understands cystic fibrosis for one, and also understands how that affects our mental health. We have been working on cognitive behavioral therapy, which has been literally life-changing in just the way that my brain works and how I can work with my brain instead of against my brain to come up with better solutions.
It's really important for clinicians to acknowledge that procedural anxiety is normal. It's expected. It is part of our flight and fight response that is biologically programmed in our bodies.
It is extremely beneficial for me when my care team acknowledges that I have anxiety. When they acknowledge it, it not only makes me feel more comfortable, but then we can come up with a solution together on ways to maybe help alleviate that anxiety or make me feel more comfortable about the procedure.
One of the most important things we can use is to encourage our patients to share their feelings. And from there, we can start to give them concrete recommendations and treatment.
I think it's really important for our care team to listen to the patients and give them time. I know that there's a schedule and there's so much going on, but taking the time to give some time when you see that anxiety is creeping in and concerns are happening is really important.
A key ingredient to all of this really, I think, is empathy. This is a constant growing and learning process, and sometimes we don't get it right the first time. These small steps can add up over time, and people and teams can accomplish things that they never thought they could in the beginning.